Hip replacement is something that's very helpful for people with arthritis. Arthritis causes pain and difficulties in the groin and hip region and affects people's daily activities. Even just basic ambulation or walking can be affected significantly by the arthritis. One of the big benefits of the direct anterior approach is that it's a muscle sparing approach to hip replacement. That way we are able to go through a minimally invasive approach anteriorly or through the front part of the hip, where we then perform the hip replacement. Hip replacement is actually removing the arthritic ball of the ball and socket, and then also resurfacing the socket, or what we call the acetabulum. There's actually a cup or socket, which is a titanium typically shell. Then there is a femoral stem also, which is titanium, which comes down into the thigh bone that the ball is connected to. Then there's a strong plastic or polyethylene spacer that's between the new ball and socket. Long-term outlook from a standpoint of hip replacement is very good. Most people do extremely well. Obviously, there are always potential risks or complications, including things like dislocation, but that is very unusual with the direct anterior approach, which is one of the benefits of the direct anterior approach compared to traditional arthroplasty.